Hey guys, it's Gabby. I did my signature assignment on leptospirosis. Leptospirosis is a zoonotic bacterial disease. There are different possible life cycles for the bacteria and how long it can remain in the body. The bacteria starts by attacking the tissues and mucous membranes can enter through a scrape in the skin and travels to the bloodstream, which can cause sepsis later on. As we learned in class, the classification for leptospirosis would belong to the domain bacteria and genus would be Leptospira. So here's a picture collected from the kidneys of a pig. You can see the simple cuboidal epithelial tissue right here surrounding, and then the bacteria inside. That bacteria, Leptospira, is actually pretty long and looks like a Twizzler. It can be transmitted via infected animals to humans and can be transmitted through contact with the urine and through contaminated water, soil, and food. It's mainly found in animals such as pigs, cattle, rodents, dogs, horses, and other type of wild animals. It mainly prevails in tropical countries because they get the most rainfall and floods, which becomes a problem when the runoff water and soil from the infected animals contaminate the area surrounding them. To prevent this disease, you can just avoid the water and soil that's contaminated altogether, or if you have no choice, you can wear protective clothing and footwear to protect yourself from the contaminated areas. Also, proper hygiene, such as washing your hands, can prevent this disease as well as other diseases. The most common physical symptoms include chills, headaches, fevers, jaundice, muscle pain, tenderness, and the most common one that stands out among the rest of them is conjunctival suffusion, which is found in the eyes and causes redness and swelling and a lot of pain and discomfort for most patients. So here's a picture of the suffusion. The bacteria starts to collect in the corners of the eyes and causes a lot of pain for most of them. An infected person can start showing signs and sickness between 2 days to 4 weeks. There are two phases of the infection. The first phase includes the more common symptoms, and patients may suffer recurring illnesses. The second phase is the most severe, where it affects the liver and kidneys, and patients can also obtain meningitis. According to the authors from PLOS, Neglected Tropical Disease, they state globally, leptospirosis has been estimated to be responsible for 58,900 deaths and nearly 1 million cases annually. That's only for the cases that are actually reported. If not treated, these symptoms could last several months and can also be fatal. Diagnosing leptospirosis includes serological tests to reveal the presence of IgM antibodies, microscopic affiliation tests through a dark field microscope, and collecting cultures that isolate the Leptospira spores. There are no vaccines to help prevent leptospirosis, but treatment includes antimicrobial therapy, and those that suffer from the second phase of the disease and more severe symptoms must receive an intravenous antibiotic therapy, which includes these listed on the bottom right here. The antimicrobial therapy can cause side effects such as gastrointestinal problems, mainly loss of appetite, nausea, and diarrhea. A person can be rid of the bacteria and it usually sheds through the urine. You are able to acquire it again because there are different strains of the bacteria itself. People who are at higher risk of getting this disease tend to be outdoor workers, farmers, and outdoor recreational sports people. In a study done in the United States and Thailand near military training sites, a group of rodents were studied for the bacteria Leptospira within the kidneys and water samples collected from drainage areas and tap water that was used for hand hygiene. After a whole year of research between 2017 to 2018, there are not many Leptospira infections found within the rodents and water samples in the US. But in Asia, out of 155 rodents and 105 water samples, about 31% of the water samples turned out to be positive for Leptospira. According to a study from the authors of the Department of Entomology, They state environmental contamination by Leptospira is the most effective route of infection than direct contact. And rodents play an important role as efficient disseminators of Leptospira in the environment. There are no AI models that I was able to research for treatment or risk assessments, but there are PCR tests that help us isolate the bacteria and can help diagnose a patient with leptospirosis. I also did find some research of vaccines that are trying to be initiated and put out into the world, but hopefully they find something. And here are my references. Thank you guys. Hope you have a good day.